I'd like to invite Ann Parr, and she's going to talk to us a little bit about the immunotherapy and spinal cord stimulation trials for spinal cord injury.
Thank you so much for inviting me here today. These are my disclosures. I'm going to discuss off-label use of medical devices. And so the first topic I was asked to talk about was immunotherapy for spinal cord injury. This is a great summary of all the different immunotherapies. Obviously, I'm not going to have enough time to talk about all this. So I try to choose like one or two trials that I can really give you some information on. So this is one that I think is out there. It's, I don't know if those of you in spinal cord injury research know Jerry Silver, and he's worked his entire life to work on this, which is nerve gen, enabling the nervous system to repair itself. And basically, he started out looking at trying to get rid of the glial scar in order for functional recovery after spinal cord injury. And so this has really progressed about taking down the neural network. And so first of all, clinicaltrials.gov, obviously greater than 1,500 clinical trials ongoing over 46 countries, if you look, and 20% are conducted in the USA. So, and many of them use venture capitalism. So I will say this is not a disclosure of mine. I'm not gaining any money by presenting this one, but this one's actually started in Canada. So this is their novel first-in-class drug candidate to repair nervous system damage, 6 different preclinical models, and they are actually expecting some results this year in 2024. So I thought I would point this one out. And so this is Jerry Silver in 1990s. He discovered that glial scars contain CSPGs, and he is worked to use a compound to combat the CSPG. And so this is kind of how it works. Initially they thought that this was going to combat the glial scar itself. Now they realize it kind of takes down the neural network so that there's opportunity for innervation. And so this is their overview. These are the preclinical studies in acute spinal cord injury, T8 compression injuries, the results so far. Here they are, and chronic preclinical studies. So they're looking at moving into actual clinical studies. Here's their study design, 37 subjects, 6 dose levels, and found that mostly safety so far, and they're moving forward with this. I'm going to talk about epidural spinal cord stimulation, which is kind of more in my field. So we discovered that epidural spinal cord stimulation can actually be used in spinal cord injury. We don't know actually the mechanism, but it's thought not to actually directly impact neuronal groups, but rather work through the DRGs to sort of lower the threshold for activation. So what you do need is as you know, most spinal cord injuries are not transection, they are contusion injuries, so there are still fibers that cross the site of injury. And in the 90s, we realized that there's this thing we call discomplete spinal cord injury, which is really important. And basically, if you use electrophysiological measurements, you can show that more than 90% of patients retain some supraspinal influence over their movement. So we call this discomplete spinal cord injury. And so currently, there are 28 studies listed under clinicaltrials.gov, and here they are. And at the top on the left, I've put our study, which I'm going to highlight here. On the right are the studies across the world. And so I wanted to highlight this one. It's something you've probably all seen in the news recently. It's called Onward Medical. It's started by Gregoire Courtine and Jocelyn Bloch. And basically, it's a company based in the Netherlands. They did this STIMO clinical trial. And basically, what they've done is they've developed a longer and wider array, which has more coverage of the spinal cord, which has been very effective. And also, they've tried to do timed series of stimulations rather than tonic stimulation. And they found that this is actually, the patients can actually think, because they also put in a brain implant, which is something new. And you can actually think about what you're going to do. And then the time stimulation, closed loop stimulation is something that's been really exciting. And so all 3 patients in this trial could stand and step very shortly. And these were all patients that had no movement below the level of injury. And they're also working on a brain-machine interface, again, for closed loop control over time stimulation. So this is our trial, and I think I'm probably out of time, but I'll just skip through this. In Minnesota, it's called ESTAN. That's Dr. Samadani, that's Dr. Darrow. They're my partners in this. And so we've been running this trial for about 5 or 6 years. I won't go through all this, but so far we have, these are all the patients. We have 22 patients. Every single patient has had recovery, some recovery. They're not up walking, but they can move after implanting these. This is one of our papers. They also can direct their movement here. They're riding a bicycle with no stimulation. And the other very exciting thing we found, which a few other groups have found, is that some patients, after a period of time, actually retain volitional movement after we turn the stimulators off, which is pretty amazing. So there's obviously, this is neuroplasticity. This a patient could not move at all, Asia A, and after a few months of stimulation, he can move. Yeah, these are some of our patients to walk. And is this the answer for chronic spinal cord injury? No, because they actually have no sensory function. They have no recovery whatsoever in sensory function, so it requires some training. So we still need some other things like cell transplantation, as we talked earlier, but these are our key findings and our future plans, and I'm just going to skip through that because I think I'm out of time.